2, 3. All right, Ying, here's a view inside your knee. You've got beautiful joint lining. This is your quadriceps tendon. We're just pumping some fluid through the knee. As I pull back, we get to see the undersurface of the patella, the kneecap. That looks perfect. There's the front of the femur. That looks perfect. Going down now to your medial or inner joint space right here. There was some question about a small meniscus tear. Let me have a hook, please. So I'll bring in a hook and we'll feel for it. Here's a hook. This is about a 1 millimeter hook. There's the medial meniscus. There's a little baby undersurface tear right there. Let's get a rasp. I'm not going to take out a bunch of meniscus tissue for that. That looks pretty good. Here's your ACL. It's injured. It should be a rope that goes from right here up into right there. I'll get a better view in just a second. Let's take a look at this lateral meniscus. Right there. Let's bring the... So there was some... I'm going to polish that area, but the meniscus itself looks pretty good. In fact, very good. Joint surfaces look good. While we're here, I'm just going to polish that one little rough joint surface. This is a shaver. It looks huge. It's only 5 millimeters across. There we go. We're not going to do any more. So that meniscus looks fine. Let's come back here and see if we can just stimulate this medial meniscus to heal. So let's see if we can bring in, this is actually a very small instrument. It looks large under this magnification. I'm going to see if we can slide it under the meniscus. Let me have a spinal needle, please. There's another way to do this, which is to bring a spinal needle and just sort of stimulate the outside to bleed a little bit and cause some scarring. I may be able to get that rasp in there now. Let me just try. Almost. There we go. So this stimulates a healing response, and I think we'll get so Ying, here is a tunnel we've created in the femur that will allow us to put a new intercrucial ligament anchored there. Here's a wire that will lead the graft into position. Now you'll see some sutures come into view. And we're just sort of working outside the knee for a moment to get these sutures aligned. And now we're going to start to work the graft into position. Now there's the endo button. That's a small titanium button that will go and secure the top of the graft. And then here's your new graft. There it is. And there it is, locked into position. So that is a brand new ACL, and it looks gorgeous. We're done. So we're done with the video. We're just going to stitch things up on the outside. We'll see you in recovery room.